Now, we're talking about the third stage of trying to access couples that are complaining that they are not being able to, give birth. So this is what is known as what? Hormones. You are requesting for hormones. So the third stage, I said third stage because the couples came to you, you took the history, you heard about all their complaints. It was cycled around infertility. You did physical examination. Then next is the lab coming in. So for the lab, you might actually want to send in some 1 or 2 tests. So to check out for hormone levels. Do you understand? So for the hormones now, we're now trying to look at which hormones will you actually, order for and the reason why. So to plan for treatment of infertile couples, usually would request hormone test and all of that. Do you understand? You request for hormone test. So the test, of course, they help to access, on the woman's side, they help to access ovulation, sperm production. Do you understand? On the man's side, or overall reproductive health. Okay, so for women, the important hormones that you might actually request for their assay, that's from the lab. You have things like follicle stimulating hormone. You also request for luteinizing hormone. Now, all of them, the reason why you're actually requesting them is on this side. That's purpose of requesting. So you have to pause this lecture and look at the purpose for requesting. Then also the anti-Mullerian hormone is another thing that you actually request for. Okay, request for that. Progesterone is another hormone you request for. Okay, prolactin, you also request for it. Okay, then thyroid stimulating hormone is another thing you request for. All of them, the most important thing is the purpose, right? Which I want you to pause and even write it down. Okay, I won't say it. Then for men, you request for hormones like what? The follicle stimulating hormone to access sperm production, how the testis is still functioning. Luteinizing hormone is still trying to evaluate testosterone production, because the luteinizing hormone and follicle stimulating hormone is produced from the pituitary gland, comes to act on the testes to produce what? Testosterone. The testosterone itself measures male sex hormone. Okay, you're just trying to look at sperm production. Prolactin, you're just trying to see if it is high, there's a suppression. Okay, in gonadotropin releasing hormone, that means there will be low luteinizing hormone, low follicle stimulating hormone. If you come back down to testosterone, it will also be low. Then thyroid stimulating hormone, that one are trying to screen for thyroid issues, okay, that can actually impact fertility.